This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page and welcome to Doc Talk. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine and features its member physicians giving information to patients that are helpful in terms of getting treatment or getting information about additional information about topics of interest to them. And with that, I have joining me here today Dr. Darinka Malushnik. Dr. Malushnik is the county medical examiner for Knoxville, but she doesn't only serve in this capacity. She also serves in. She also provides medical examiner capacities to other surrounding counties as well as regionally. And Dr. Malushnik is here to talk to us today about sudden infant death syndrome, or SIDS. Welcome.
Thank you.
Being a medical examiner, sudden infant death must be something that you deal with quite often in your practice. What sort of general information can you give patients about what sudden infant death syndrome is, and other general concepts about it?
So, sudden infant death syndrome, or SIDS, actually is a term that we kind of abandoned or started abandoning. Kind of, it was a process about 10 years ago.
Okay.
And the reason for that is that we realized through our practice of forensic pathology and medical examiner practice, is that syndrome essentially in medical terms means that it's constellation of symptoms and findings and kind of clinical sort of circumstances that create one particular entity. And then we realized through our investigation, because we do scene investigation along with the law enforcement, kind of independent investigation, and through our practice of postmortem examination and ancillary studies, that a lot of these kids were kind of all different categories. And many of those were actually in a category of unsafe sleep. And so we realized that actually there was not really a syndrome or disease. Sometimes there were just unfortunate circumstances, such as unsafe sleeping environment, bed sharing, kind of co-sleeping under really unfavorable conditions. And then we sort of changed our view and kind of alerted the public in a way. It's like, look, it seems from what we are doing on a daily basis, so to speak, unfortunately, because those deaths used to be higher, is that many of these preventable deaths stem from unsafe sleeping environment. And then so we suggested, how about this? Let's abandon SIDS term. Let's call it sudden unexplained death in infancy, it's like a SUDI. Okay. And then we'll assign it kind of more characteristic or more specific kind of cause of that and manner of that, depending on what we find. And that's where the Back to Sleep campaign came from. Mm-hmm. Actually, really, it kind of stems from efforts of the forensic pathologists and medical examiners to say, hey, it seems like that we should maybe implement education into safer sleeping environment that might prevent some of these deaths. And actually, the numbers have come down. They have improved. And the reason why I wanted to bring this subject up today is that the effort is there. All the hospitals, looks like our OBGYN and especially neonatal units are educating parents. It's just the problem is that it's a very emotional kind of stage in their lives when the new baby's on board. There is a lot to think about, and maybe they don't really absorb necessarily all the information. Or as young parents have to go back to work, they essentially give these young babies, neonates, infants to somebody else to take care of, where the grandparents or some other relatives are not kind of aware of what's going on and what the new educational material these parents have received, and then put the babies on soft beds or fall asleep with them on the sofas and other kind of unsafe sleeping environment. And that's why it's really important to kind of bring it up, not just with the new parents, but with the community in general. You know, if you have a small baby, and a lot of times, not all of them, of course, because we do our diligent investigation and try to get to the bottom of each and every case on their own merits and individual basis. But a lot of times, actually, still, unsafe sleeping environment does happen in spite of all the educational efforts, and maybe just kind of bring back this kind of awareness that we should all think about it, especially if you're taking care of young babies in some sort of extended sort of relative situation, including grandparents or even kind of daycare unit that is not necessarily licensed or situation like that.
So when we talk about SIDS or SUDI, as you mentioned, does that include patients or infants who've died in unsafe sleeping environments as well as other unexplained deaths? Is it still the same category, or are there two separate ones, one with unsafe sleep and the other one that's considered SUDI?
So when we receive a call, it becomes a SUDI.
Okay.
And then through our process and investigation and the further studies, then we kind of separate them. There's a small, let's say, out of we used to have like 50 babies a year that would die under these kind of unknown circumstances. We reduced that number to 20. So that
Wow.
we made progress. Out of those 20, I would say that a quarter of those have some other reasons, but there's still 3/4 of those, which means like, let's say 15 babies, that are lost because of unsafe sleeping environment, which we sometimes can categorize as positional asphyxia or overlaying or something of that sort that is considered a kind of accidental death, and obviously because of that preventable.
Right. Well, I can remember in my training when we talked about SIDS or sudden infant death, there were a lot of different correlations that were made. We talked about, and there was really no single aspect of it that we could figure out that actually was relating to all of these. And they certainly talked about sleep and recommendations for sleep, but they were sort of, when I recall, that there were actually multiple recommendations, some for back, some for side, some for different places that
Right.
the way the baby should sleep. So what are the current recommendations and what age for sleep environment for infants, and what age children are we talking about?
Right. So actually it's really simple, and I also have to add that our state actually has done a great effort when the parents go home, and especially like a lower income situation, they actually go home with the kind of a pack and play, like a little area that the baby can sleep. The problem is when we go to these unfortunate scenes is that it is there, it is set up, but it's filled with stuff, with junk, and the baby actually sleeping with the parents, between parents in adult bed with a lot of bedding. So we are still seeing that, and it should not be happening because they have the means. They're actually provided the safe sleeping environment, so to speak, but they're not utilizing it.
Gotcha.
And maybe just kind of emphasize that we should take advantage of that. And the second thing is that your question was regarding
what the current recommendations were, and what age group of
so that basically means the recommendation is, and especially up to the age of 1, is baby alone with very, very little bedding or none, just actually some safe or warm, not too warm of outfit, and no that bumper pillows, no extra pillows. All the baby need is just like a nice firm mattress with a simple sheet, and that's about it. And it has to be crib, cradle, no toys, because they don't really need that. And even the blankets, it could be very light blanket, but sometimes they don't really need that either. So, and put the baby on the back. They're going to be just fine. Now, there are certain medical conditions, obviously, that there are different recommendations with some severe reflux or something. That's something definitely for pediatrician, neonatologist to discuss with the family. But again, unless the baby has some serious reasons, not to put them on the back, it's always back, firm mattress, and no other extraneous, pillows or anything else, because they really don't need it. And the another important thing is that as far as the bottles and stuff like that, they don't really need any of that. I mean, they really just if they're fed, of course they're going to be taken out. But as soon as they're done, they should be put back in that safe environment with no extra material around it. And another thing that we are seeing, because it kind of subsided for a while, and I was seeing again, sometimes parents, let's say they are concerned about the reflux, so that they use that boppy pillow to support little baby. And it's very, very dangerous. It's really, those are pillows.
We're talking about the wedge pillows?
No, they're actually kind of,
the
crescent
semicircular
shapes, semicircular pillows.
I
They're
remember.
actually designed for nursing. They help
Right.
with nursing. Actually, I had a couple when I did the nursing. They're designed for that. They're not really designed to be put in a crib for the baby to be propped up or anything.
Gotcha.
There's really no reason for any child to be propped up on a boppy pillow unless they're awake and they're trying to kind of exercise, lift their arms or tummies on the pillow, supervised. Other than that, there is no reason for that. And I have to bring one more thing.
Right.
That for if we notice that something is being utilized or kind of dangerous in a way, for a while there was like some rock and play. There was a little sort of sleeping. It wasn't even a cradle. I don't even know how to describe it. We saw a rash of cases that the babies were dying because they would be put in the middle of the night in that little kind of rock and play sort of setup, but it was too soft, and the baby would kind of roll in the middle of the night, or if they're not perfectly positioned or supervised, as they are not necessarily in the middle of the night, and the babies will roll. So we reported those cases, and out of 12 or 13 that were actually reported nationally, there was 3 or 4 that came from our region.
Oh, wow.
And they essentially pretty much put a stop to distribution of those unsafe sleeping surfaces. So that's why I'm saying that's part of what we try to kind of reach out to the community, alert the parents and
Right.
the healthcare workers, but also report those to consumer safety agency, because that's how certain kind of dangerous products can be eliminated from the market.
What is the most common circumstance in which you see these recommendations that you say in being violated? Would it be the parents having the child in bed? Would it be a blanket? Would it be soft bedding? What is the most common situation that you typically see?
Bed sharing with the baby. Parents putting the baby in the middle in the bed, or one parent and an older sibling, and the baby in between. And so that's most common.
So what is, and of course, the drive behind this for parents is they say, well, the child sleeps better with me, or they feel comfortable when they're with me. What is it that you can tell parents to get them to not do this so they can eliminate this risk for their children?
It's really unsafe for them. And I know actually even some anthropologists, like cultural anthropologists, were promoting, the bonding and sleeping together. That's one thing to bond and sleep together with a mom who, let's say, nurses on a flat bed, firm mattress with nothing around. Although that's not really the best necessarily scenario, but in situations that we are encountering, that's really not the choice. That's not the bonding, and it's definitely not safe for the baby, and it's way too dangerous. And then again, no reason for child to be there, because the sooner they're essentially put by themselves, the better it is for the parents. Then the parent can get actually rest.
Right.
Because sleeping with the baby in the same bed is just not really restful to
No.
begin with.
And also the one thing you emphasize, which I want to re-emphasize, is that this information is not only important just for parents, but it's important for extended families.
That's correct.
And it's important for everybody to know, because as you mentioned, grandma may be taking care of the child, and there, of course, there were different recommendations back when they had little children.
That's correct.
And mostly not very many recommendations even at that.
Right,
So,
because we had some situations where the baby would be put on a big fluffy bed with because there's always need to make them comfortable. They don't need that. They don't feel that comfort. All we are creating is just a situation for them to suffocate.
right.
And the grandparent would or older relative would say, but that's what recommendation was 30, 40, 50 years ago. Well, that's not.
And so what about and these children don't get cold, and they don't get they don't need these blankets.
That's correct.
They don't need all these bumpers around the crib. They don't need any extraneous items in there with them. They just need to be by themselves, in appropriate clothing, depending upon the weather.
Exactly.
A simple sheet, flat mattress on the back.
That's correct.
And I don't think anybody can argue with the numbers that you're talking about, because you've gone from 50 a year, as you mentioned, down to
21.
down to 21, which is unbelievable.
Yes.
Dr. Malushnik, is there any other resource or any site, website or telephone number or place that you'd like to suggest that parents go to get this information or get additional information about this?
So the main, the parents who lose their children under these circumstances, again, we always recommend, and especially if the child was with us, to reach out to us, because we can always have a conversation. And there were some other scenarios where we discovered certain conditions, that nobody was aware of, that actually influenced not only what would happen with a younger sibling. There was for example, 1-year-old child, but also how the pediatrician would then handle that situation. So that information actually came from us. So I always encourage the parents to reach out to us, to talk with us, and especially if they have hard time understanding what happened, because it's extremely traumatic and tragic.
Right.
That's one of the most traumatic situations one can find himself or herself in, and there is no reason for blame or anything of that. It's just it's time for sort of I guess reconciliation and some sort of finding an answer that might happen, because a lot of these parents are young and they're going to have children again, and although I cannot tell them that because that would be very callous of me. But it's always good to keep in mind, it's like what can we do better next time?
Right, and to have the information for next time so that history doesn't repeat itself and they end up with the same problem.
That's correct.
Again,
and I also have to emphasize that we do communicate with the pediatricians, and they're also armed with the knowledge that, obviously talking to a pediatrician always is helpful.
So, well, we're going to put your information, your contact information on the bottom of the screen here, and then any other information that you'd like to give out, any websites or et cetera that you'd like these parents to be able to go to get additional information on how they can prevent this horrible situation. So, and thank you so much for joining me here today.
Thank you.
And with that, this brings this episode of Doc Talk to a close. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that are helpful in terms of their decision making. And with that, I'm Dr. Rob Page, and thank you so much for joining us here today.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.